When we say baby blues, what do we mean by baby blues?
Well, it can last for a few days, generally starts on day 3 to day 4. Usually the first symptom will be becoming tearful and maybe crying for no reason. Now, if this goes beyond a week to 2 weeks, then we need to start looking at possible postnatal depression. That's maybe then when it may become a problem.
And when a mother would be out of the hospital, when she leave the hospital with the child, and this happened on day 3 onwards, who would she be going to mention this to?
It would be good to talk to your partner, and if it did go on for an extended few days, your public health nurse, or if the woman sometimes would be linked with their local mental health team and maybe the community mental health nurse, to contact them. Generally, if there has been a history of postnatal depression, myself or my colleague would be contacted here in the hospital, and we would go up to the maternity ward and we would talk to the mother and find out how they're feeling. And then we would link them to the local mental health team if the need was required.
So if this continued in for 2 weeks and after, you'd be advising to contact the GP, would it?
GP, their public health nurse, their local mental health team. The GP would usually refer, that he would be the primary key worker, he would refer them on to the community mental health team if the new mother wasn't known. What you would be watching for is feeling low in your mood, poor sleep, and I know sleep is difficult to get, especially with a newborn baby, but if they were finding it more difficult than normal, that would be a problem. There could be feelings that they were feeling rejected by their baby, or there could be feelings of maybe harming themselves, possibly harming the baby, and this is definitely where they would need to link in with their mental health team.
Now, Marie, is it quite normal for every mother to feel baby blues?
Absolutely, it is.
It's just when it continues, you'll be reaching for
when it goes to an extended period of time, that's when you need to be concerned.
And you don't need treatment. Do you need treatment for
baby blues? No, generally they pass. But if it doesn't, you will be looking at treatment then, maybe going on an antidepressant for some time.
Now, Marie, could you explain me, please, what's the difference between postnatal depression and baby blues?
Well, the baby blues goes on generally for a few days. If the blues get any deeper and go into a deeper depression, that's what we call postnatal depression, and this does need to be treated.
What advice could you give partners or husbands out there if they notice, or what should they be watching for after the woman having a baby?
Well, after the woman having a baby, especially a first baby, the partner should watch out for their mood, how their appetite is, if they're not eating as much, if they're weary going around the house, if they're not coping well with the baby. The partner can watch out for all of these things, especially if the woman expresses a fear that she doesn't feel like living anymore. It's hugely important that the partner then contacts the GP, the public health nurse. You can go to the local emergency department. I know in Mayo University Hospital there's a 24-hour psychiatry on call available in the emergency department. The partner should also, I suppose, ask family to help. Maybe get someone to do the laundry, someone to mind the baby for a while, help with other children if there are other children there, just to offer good help, good practical help to a new mother.
There was another sort of illness that it's not postnatal. There's another illness. Could you tell me a bit about that, please?
That's called puerperal psychosis, and this can generally happen 1 out of 500 new mothers. It is serious, but it's very treatable, and generally the mother would require hospitalisation. They lose touch with reality and they're not able to function. So they do need hospitalisation for this.
Could you explain me a little bit more, Marie, please, about what you mean by they lose touch with reality? Like, could you go in a bit deeper into that, please?
They may be having hallucinations, they may be seeing things, they may be hearing voices, they may be feeling rejected by their baby, they may have feelings that their baby is bad, and then there's a fear that they may do something to harm their baby or to harm themselves. So it's all about keeping mummy safe and keeping baby safe.
And when would this be noticed? Is it
It
after the baby blues gone, or?
Generally, it can happen maybe within the first 2 weeks after having the baby. And if there has been a previous history of it, that will be noted. And once the mother gives birth to the baby, the mental health team in the hospital here will monitor mummy and refer mum to the local mental health team after discharge for support and follow-up.
And finally, Marie, is it the same symptoms and signs for this one as it is for postnatal depression and baby blues?
Postnatal depression means a low mood. So you would be, as I said before, poor appetite, poor concentration, poor energy, poor motivation, no interest in any of their usual activities that they would like.
Lovely. Thanks very much, Marie, for your time.
For nothing at all.